Welcome back! In today's video, we're going to be talking about a medication called Olanzapine or Zyprexa. And this is in response to a viewer who asked us to make a video specifically on this medication. So if you would like us to make a video for you, drop that video idea down in the comment section below. So in this video, we're going to talk about the top 7 things that you need to know about olanzapine. We're going to discuss what olanzapine is, what olanzapine is used for, how long does olanzapine take to work, is olanzapine addicting, what are the common side effects for olanzapine, what are some of those drug interactions related to olanzapine, and finally, number 7, my final thoughts. So without further ado, here we go! Starting with number 1, what is olanzapine? Olanzapine is an atypical antipsychotic, or also known as a mood stabilizer. It has a high affinity and binds to the 5-HT2A and histamine 1 receptors. It also binds to D2 receptors and blocks D2 receptors, which reduces positive signs and symptoms of psychosis. It also blocks those serotonin receptors at the 5-HT2A and 5-HT2C. And this action increases dopamine in specific areas of the brain that are related with cognition. So this will improve cognitive symptoms and also negative symptoms like a blunted affect or emotional flattening. Blocking that 5-HT2C can also increase norepinephrine. And when it's combined with fluoxetine, that specific action is enhanced. Olanzapine comes in oral tablets, also disintegrating tablets. There's an immediate release injection and also a long-acting injection. So, number 2, what is olanzapine used for? Well, olanzapine was FDA approved in 1996, and it was approved for the treatment of acute mania in bipolar 1 disorder, also acute episodes with mixed features of bipolar 1 disorder, and for maintenance treatment of bipolar 1 disorder. It's also used for the treatment of bipolar depression when it's combined with fluoxetine. Also, when it's combined with fluoxetine, it's used to treat treatment-resistant major depressive disorder. It's also used for schizophrenia treatment, and that is the oral and the long-acting injection. The long-acting injection can also be used for maintenance treatment of bipolar 1 disorder. It can also be used and is FDA approved for acute agitation or aggression associated with a psychotic disorder. Off-label uses of olanzapine include bipolar 2 disorder, so hypomania symptoms, major depressive disorder with psychotic features, and it's also used with agitation, aggression, and psychosis that's associated with dementia. However, there is a black box warning related to the use in this specific population because there is an increased risk of mortality with elderly patients with dementia-related psychosis. So it's also avoided in patients older than 65 years old because there is an increased risk noted for cerebral vascular accidents or strokes, and a greater rate of cognitive decline and mortality seen in patients with dementia. So if it's being used in this case, it's used in very small doses, and the risk and benefits have to be weighed because you have to look at how much the agitation for that person is affecting their quality of life. It's also used off-label for the treatment of anorexia and chemotherapy-induced or acute and delayed nausea and vomiting. So number 3, how long does olanzapine take to work? Well, if you're using the immediate intramuscular injection, it's going to work within 15 to 30 minutes. If you're using the oral tablet to treat psychosis or manic symptoms, you're going to see some results within a week in treating those specific symptoms. Those cognitive and affective symptoms will begin to improve over time, usually within 4 to 6 weeks, but can take up to 20 weeks. Once a person is stable on the oral medication, they can choose to switch over to a long-acting injection, and this would be taken every 2 to 4 weeks. If you're taking the oral tablet for bipolar 1 depression, or treatment-resistant depression, results of the medication are typically seen within 2 to 4 weeks. And this is at therapeutic doses. So therapeutic doses for bipolar disorder are 5 to 20 milligrams a day with a max of 30 milligrams. But there are some reports of using this medication and showing efficacy in doses up to 50 milligrams. However, if you go that high, you're just increasing your risk for side effects. So number 4, is olanzapine addicting? Well, it's not addicting. However, as we mentioned in this video on antidepressants and addiction, the same thing applies for this class of medications. Neuroadaptation can occur, and therefore you must be prudent about coming off of the medication very slowly to avoid any withdrawal-like effects. This is also the case if you're cross-tapering to another antipsychotic. And if you're cross-tapering, it's going to depend on what you're cross-tapering to. The recommended schedule of the cross-taper may change. And so that's why it's a good idea to look at that switchrx.com as a reference guide on how to cross-taper olanzapine with another antipsychotic if you're switching this medication. And so number 5 is those side effects. So what are those side effects? Okay. The most common side effect is sedation, and you really can't bypass this because it's extremely common because of that high affinity for the H1 receptor. So it has antihistamine-like effects. It also has anticholinergic effects, which include dry mouth, constipation, and perhaps urinary retention. It may also cause orthostatic hypotension, and this is where your blood pressure drops rapidly if you get up too fast. And so therefore patients who are on blood pressure medications really need to monitor this, and this is also higher risk in the elderly. It can also cause weight gain, and up to 31% of adolescents report this, and up to 22% of adults report this. So this is a common finding. And it's not just the fact that it increases appetite. That is one component of olanzapine. However, it may also cause metabolic syndrome. And this is where you have a high blood sugar, high cholesterol, elevated triglycerides. And so therefore it's important to get your lab work done. You want to get it done at baseline and then every 3 to 6 months so that you can keep an eye on these specific levels. Less common side effects are going to be elevated prolactin levels, which can lead to gynecomastia or breast development. This is particularly uncomfortable in men. And galactorrhea, which is where you're lactating even though you're not pregnant, and this can also happen in men. For women, amenorrhea or absence of their menstrual cycle can occur due to elevated prolactin levels, and this elevated prolactin level can also lead to sexual dysfunction. Another less common side effect is elevated liver enzymes. Again, another reason why it's important to get your blood levels checked. Photosensitivity and a benign rash may occur, along with what's called extrapyramidal symptoms, which I mentioned in the video I did on Abilify. And this is typically dose dependent and seen more often in doses greater than 15 milligrams. So you can have acute dystonia, which is the involuntary contraction of the muscles of the face and neck, and a lot of times it's like a stiff neck. Tardive dyskinesia, which are repetitive muscle movements of the face, neck, arms, and legs. Extrapyramidal symptoms can also include drug-induced Parkinsonism, which is like a pill rolling movement or shuffling gait, and akathisia, which is the restlessness or a severe form of agitation. that someone will embody or feel inside of their body. Now, this is less common than what's seen with typical antipsychotics. However, it's something that should be monitored every time you see your provider. They should be monitoring for these specific symptoms. Now, some rare and dangerous side effects that may occur with olanzapine include syndrome of inappropriate antidiuretic hormone, or SIADH. And this is where you get fluid retention and low sodium levels or hyponatremia. And this can lead to muscle cramping and weakness. Another thing that can occur is the dyslipidemia, or that metabolic syndrome, can lead to acute pancreatitis. So any severe abdominal pain needs to be attended to. Another rare but dangerous side effect with olanzapine is this rash called DRESS, or drug reaction with eosinophilia. And what this is a rash that is systemic throughout the entire body that includes a fever, facial swelling, enlarged lymph nodes, kidney or liver injury. The increased eosinophils, or those blood cells that respond to allergic reactions, can also cause organ damage when they're present in large numbers. And so that's how it can actually lead to death and is a very serious side effect. And so if you start having a rash with olanzapine, you definitely want to have your doctor take a look at it and see if it meets the criteria for this type of specific rash. Another rare but dangerous side effect is seizures. So this medication can lower the seizure threshold. And neuroleptic malignant syndrome, or NMS, which we also covered in the video on Abilify. This is believed to be due to a reduction in the central nervous system's dopaminergic tone. Along with the dysregulation of the autonomic nervous system, you'll have a high fever greater than 102 degrees, an elevated blood pressure, increasing heart rate, also respirations, muscle rigidity, and altered mental status. So if you're having any of those symptoms, that's an emergency and you need to get to the emergency room right away. And so, number 6, what are those drug interactions? So olanzapine is metabolized by the CYP450 1A2 and 2D6. So therefore, you have to be mindful of inhibitors and inducers. And common inhibitors of the CYP 1A2 is going to be fluvoxamine. And inhibitors of the CYP 2D6 are going to be bupropion, fluoxetine, paroxetine, and CBD. And so with inhibitors, typically, because it's inhibiting the metabolism of olanzapine, you're going to have higher levels of olanzapine in your system. And that's why when olanzapine is used with fluoxetine, because that is an inhibitor of the CYP2D6, it's used in very small doses. Now, inducers will induce the metabolism and speed it up, therefore requiring higher levels of olanzapine. Inducers of the CYP1A2 include tobacco. So people who smoke cigarettes are going to need higher doses of olanzapine. This also includes THC or marijuana and a medication called carbamazepine. Now, there are other inducers and inhibitors of these substrates. These are just the ones I wanted to highlight for this video. But just keep in mind that if you're taking an inhibitor or an inducer of this enzyme, that your doctor may want to adjust the dose of olanzapine. That includes if you stop smoking, your dose may need to be adjusted. Other drug interactions to consider are anticholinergic medications. So medications that affect this pathway are just going to increase those anticholinergic side effects of olanzapine. Also, blood pressure medications are going to increase that risk of orthostatic hypotension or decreasing blood pressure, and oftentimes those blood pressure medications can be reduced when olanzapine is taken in conjunction. When olanzapine and a blood pressure medication are taken together, oftentimes the blood pressure medication is reduced. Parkinson's medications will decrease the effects of olanzapine because it's actually doing the opposite in the brain than olanzapine does. So it's a complete contraindication there. Other medications and substances to pay attention to are CNS depressants, or medications that make you more somnolent. Remember, one of the main side effects of olanzapine is somnolence. So if you take something like a benzodiazepine that will induce somnolence, or even drink alcohol or any substance that can also induce somnolence, that effect is going to be more enhanced. And so, number 7, what are my final thoughts? Well, olanzapine is a very effective medication to treat the spectrum of bipolar 1, especially bipolar 1 depression when paired with fluoxetine. Its only downside is the weight gain. Now, there is a new medication out called Lymbalvi, which utilizes samidorphan, which is an opiate antagonist medication with olanzapine to help minimize or mitigate the impact on weight. And in clinical trials, it's showing that there's really no impact on weight when these two medications are combined. However, this is a branded medication. It's very new, and so if you don't have insurance in the United States, it's going to be very expensive. And so an alternative thing that can be done with olanzapine if patients are experiencing weight gain is the addition of naltrexone. Naltrexone is also an opiate antagonist, and so therefore has very similar results as Lymbalvi. So if you're on olanzapine, you're having great results, but you're starting to have those effects of weight gain, ask your provider about adding naltrexone if you don't have insurance and can't go the route of going straight to Lymbalvi. Another thing about olanzapine that's a downside is that patients who are at increased risk for diabetes or even have diabetes may need an alternative treatment option because of that metabolic syndrome. And so therefore, a lot of times patients with diabetes will either need alternative treatment or frequent monitoring of their blood work. Another thing to think about with olanzapine that I found interesting in my research here is that the clearance of olanzapine is slightly reduced in women, and so women typically need lower doses than men. Also, something to keep in mind with olanzapine is that you should avoid use in patients with ankle closure glaucoma and acute cerebral vascular disease because of those anticholinergic effects, and then also because of the increased risk of mortality and possible stroke in patients greater than 65 years old. So that's it. That's my overview on olanzapine. Did you find it useful? If you did, go ahead and like and subscribe to the channel. It really helps us get the message out to others. And be sure to share your experiences if you have any experience with taking this medication, as we learn from sharing each other's experiences. Also, as always, I wish you well on your mental health care journey, and I'll look forward to seeing you next week.